欢迎大家。Let's start. Um, I don't know if you've heard a previous introduction to the program. So if you have heard some of the information before, just ignore it. And for the rest of you, if this is the first time, I hope that you will find this interesting. So, we are our clinic, CCACC Health Center. We are an ARC provided champion. What that means is that we are in partnership with the Korean Community Service Center, and they have a grant with the Asian Health Coalition based in Chicago. And this is part of the engagement and recruitment core for Asian Americans, Native Hawaiians, and Pacific Islander. And the bigger umbrella over all of this is the All of Us Research Program. Next. So what is the, you know what? I cannot see the participants, and it's like talking to a blank. 你们大家如果可以开你的 video，请你们开一下。Okay. You guys can see me, right?
Yes.
Okay. 好。So what is the All of Us Research Program? The program is something that is under the National Institutes of Health, NIH, and it is part of the Precision Medicine Initiative. And what they're trying to do is to say that the future of health begins with you, begins with all of us, because they're trying to gather data from 1 million people to build a database so that there is enormous power in having 1 million people's data in the data research repository. Next slide. So what is precision medicine? Precision medicine is an approach to individualized treatment. So up until now, when we say anybody has a disease or anybody is being treated for that disease, we take data from an aggregate, and it may or may not represent us specifically, but that data is extrapolated to all of us. So it may apply, it may not apply exactly. So precision medicine is an approach to try to improve on that. And it is saying that everyone is an individual, everyone is different from someone else. And the approach to diagnosis, to treatment, is that we have to take into consideration the individual characteristics so that treatment is much more individualized, okay? So all of us research program is intended to help accelerate, to advance precision medicine research. Your slide is not showing the, okay. So what precision medicine is saying is that an individual has a lot of variability, whether it's in their lifestyle, in the environment they live in, or the biological makeup. So what do we mean by that? For example, in lifestyle, what you eat, how active you are, how physically active you are, and if you smoke or drink, all of these characteristics can impact your health. The same with the environment, where you live, whether it's in an urban setting, a rural setting, whether you're near a factory, whether you're in high altitude or low altitude. There are uh, uh, effects from the environment that you live in that will affect your health. And of course, everybody would know this, your biology, which comes from your genes, your family history, what you inherited from your family, um, and your own health history. All of this will affect your health. And if you do have a condition or a disease, all these come into play and affects whether or not there's treatment for you, affects whether or not the treatment is effective for you. Next slide, please. So a little bit more about precision medicine. Precision medicine acknowledges that each person is unique, and each person is reflected by what their habits are, their environments are, and their biology. And the interaction among all of these factors will greatly impact each person's health. These unique variables also mean that a medical treatment that works for one person might not work as well for another person, right? And so rather than using a cookie cutter, one size fits all approach, which is how, in general, we've been doing medicine all along, right? We will say whatever we discover from the trial, whether or not you're represented in the trial, we take the results from the trial and generally apply it to the larger population. So that's a cookie cutter kind of approach. But with precision medicine, we want to say, in addition to having clinical trials and having knowledge and research, we try to bring the individual characteristics of that person into play so that we can deliver the right treatment for the right person at the right time. And hopefully, we can keep people healthier longer, meaning we can actually prevent disease. And ultimately, precision medicine will be able to produce a more accurate diagnosis, and you could detect the disease earlier. And because of the knowledge we've gained from precision medicine, we can have better prevention strategies and treatment choices. Next slide. And what do we mean when we say precision medicine? In case, it's just not clear what exactly do we mean by that. So there are two examples provided here. Um, and it should give you an idea about how every individual is different. So when you talk about your vision and when you talk about where you need to wear glasses, right away, some people need glasses for reading and some people need glasses for long distance, right? But no matter what, everyone's glasses have to be tailored to the individual. So you go to the optician and they'll do their tests, and then they'll come up with a prescription for what your glasses should be. So that is a very early example of how we have been practicing precision medicine in that arena. Another example, also, which should be very familiar to all of you, is that when you need blood, and you can't just take blood for anybody, right? Because everybody has a different blood type, and it is it could be harmful, even fatal, if you just give blood from anybody and the blood types don't match. So with precision medicine, we do blood typing, right? And we have been doing this. So we try to at least match that the blood type that you get is compatible with you. So these are the two immediate examples. Next slide. So this whole thing, the plan for the research, all of us research program, came about because there was a federal initiative called the Precision Medicine Initiative. And the All of Us Research Program is the cornerstone of that initiative. So it is led by NIH, although several other federal agencies are also involved. And the goal is that this research program would be able to enroll 1 million or more participants. That is an enormous size for a research study. When we do clinical trials, we do them in several hundred people, several thousand people, or 20,000 people, 50,000 people, 100,000 people. But this is 1 million people. So this is incredibly huge if we get the 1 million participants, and all the data will be in a data repository to be used by researchers. This All of Us research program moving forward into the future it's trying very hard to do one thing that we have not been able to do in the past. It is trying to include in the sample of participants the broad diversity of the US. So, for example, there are groups, and such as Asians is one group, Native Americans is another group. There are lots of different smaller groups of people who traditionally do not participate in research or have no access to participate in research. And research is pretty much done on whoever will come to participate, and largely it reflects the US population, the non-Hispanic white population. So that data is being used for everybody. So all of us is making a lot of effort to try and include the broad diversity that is present in the US. It allows for participants to provide data on an ongoing basis. So this is clinical research. This is not a clinical trial. And as long as there's funding to continue the research over the long term, they can ask you questions. They can ask for data from you that if you want to participate, and that data will be collected over time. So that things change and people age, but we can still get the data. The data then is put into some standardized format that the data center will manage, and then researchers will be able to submit their research ideas for what they want to study. Out of 1 million people, they will say, well, I'm trying to discover how to diagnose this condition, what are the genes involved, and what are the characteristics among different subgroups, and then can I find out a treatment for this condition? So they submit their research ideas. It goes to a committee who decides whether or not that research is feasible and worthwhile, and then they will be provided access to the database. The participants themselves also can look at the aggregate data. Some of that is available on their website so that you can find out, what's going on with the research, what information has already accumulated. So the hope is that over time, as we keep collecting data, and if we have 1 million people in the database, then it's a rich database that will serve as a catalyst for innovative research program and policies. And it keeps going on. So in 2025, somebody may have a research idea that in 2028 will be much improved upon. So the research is ongoing, the ideas are ongoing, and innovation is ongoing. Of course, the data will be protected by privacy principles, and there's a data security policy principles and framework to make sure that they safeguard your data. Next slide, please. So very briefly, the All of Us has a mission and many objectives. The mission, of course, is to accelerate, to advance health research and medical breakthroughs so that individualized prevention, treatment, and care can come out of this database. The way they're going about doing this is that they're much more inviting of participant input and feedback, and they want to nurture a relationship with you over the long term. It's not a one-shot deal, right? When you participate, they will ask you a lot of questions. You can do a lot of surveys, but over time, they want to nurture a relationship, an ongoing relationship with you so that they can tell you, oh, we have more questions, for this, maybe it's all neurological, or maybe it's all behavioral, or maybe it's all about aging. So over time, they can keep coming up with more surveys, more questionnaires that you can choose to participate in. So this is very different from a clinical trial, which is very limited in time. And that as they continue to get data from you, the data is being kept, and they're hoping that this will be the largest, richest biomedical data set ever that will continue to be used for as long as we have the program. And that the other piece of this is there's a robust ecosystem of researchers who will have to keep coming up with research ideas and submit their requests to use the database to answer a specific research question. Next slide. And the other piece of this that's really important, and that's why we are encouraging our community to participate, and why we are participating with the All of Us program and have become a provider champion, is that they really are paying attention to capturing diversity in the US. So they want to say that we are making a lot of effort to include people in this country who traditionally and historically do not participate in biomedical research. They are underrepresented. And so we do know that the Asian community is underrepresented in research. And so this is why I am encouraging everybody to look into this and see if you want to participate or not. And if you do, you will be helping to create enough data on the Asian subgroups so that we can get useful information from that to design treatments and to design prevention strategies that are much more relevant to us, right? So across the US, in terms of the All of Us research program, they're trying to get people of all backgrounds, all US residents, anyone aged 18 and up. And unlike a clinical trial where you're looking at a very specific disease, the people in All of Us do not have to have a specific disease, and they can be healthy people. So we take all health status. You can be healthy, or you can be having a disease, etc. The geography, we include everybody from all across the US. And in fact, they try to get the urban and the rural setting because there are definitely differences in that. The environment is different. So the geography will cover various environments and also various parts of the US. And the data type that is being collected, there are lots of data types because we can have measurements that come from blood samples or saliva samples, or some measurements of people, but it also includes data from surveys. And so these would be questionnaires that you would fill out. The other piece that is very, very robust for this database is that if people agree to share their electronic health records. So then we have health records that are put together from by a health professional, right? Your healthcare provider, and if that goes into the database, then they can literally look at people both their age, their race, their geographic distribution, and then what conditions do they have, what medications are they taking, and whatever is in their health record. And then researchers can try to study what the connections are among all these variables. Next slide, please. So why are we even talking about this? We are talking about this to our community. So you're all familiar with the CCACC network and our newsletters and our health talks that we've been offering every month. This research program is important to us because we are just not well represented. So this chart is showing us that in the United States, when you look at participants in research by race, the Asian group is the red. It's 2.1%. So if we continue to not participate in research, then everything that we get is based on data from other people. So 81% comes from white people. 14.5% comes from Black or African Americans, and there's some missing data and there's some other. So we have to do better than the 2.1%. Across the US, the general total percent of Asians comprise at least about 6%. So we should at least try to participate in research at the 6% level. But instead, this chart is showing us it's 2.1%. Globally, it's a little bit better. The rest of the world, 16.1% are Asians, but that's still a minority. So by not having data specific to Asians in particular, it is troubling because some treatments actually don't work in Asians. So one example of this is that the drug Plavix, which is to prevent blood clots, was developed mostly among whites because these are the people in the clinical trials. And yet, Plavix is generally available and being used to treat anyone, right? And the concern here is that in Hawaii, it was heavily marketed. But in Hawaii, the composition of the population is 45% Asians and 77% Pacific Islanders. And we don't have very much data that actually pertain to them. And what we found out about Plavix is that when you do give this drug to Asians and Pacific Islanders, we know it doesn't work that well because in 45% of Asians and 77% of Pacific Islanders, the drug is ineffective. So I can't emphasize stronger than to say it's up to us, all of us, to contribute the knowledge to the database. And the only way that we can improve treatments for our group is that there's actual data that, and they've tested it in us. Next slide, please. And here's another slide that points out that there are certain conditions and health disparities in Asian Americans, Native Hawaiians, Pacific Islanders compared to non-Hispanic whites. Some of this may be very familiar to you already. For example, stomach cancer occurs in, it's more women who are Asian, 76% more likely to develop stomach cancer. So I won't go through every detail here, but some of these conditions include stomach cancer, diabetes, liver cancer, hepatitis, tuberculosis, that it is disproportionately more prevalent among Asian communities. Next slide, please. So with the All of Us research program, it is a plan, strategy, and an attempt to put out to the nation that everybody should participate. They should go make more efforts towards capturing the diversity that's currently present in the US. And so we need to do our part by being willing to participate, right? So if all of us contribute and our data is in the diverse database, um, there will be more opportunities for us to find out things that pertain to us specifically. For example, what are our risk factors for certain diseases? It may be different from the larger general population. What are the best treatments that work best for people of our background? And then it also can connect people with the right clinical studies for their needs and learn about how technologies can help us to take steps to be healthier. Next slide, please. So by participating, you will enable researchers to learn more about what keeps us healthy or makes us sick, and what are the differences among different groups, for example, racial groups, for example, socioeconomic groups, for example, geographic location groups, et cetera, et cetera. And also to identify which treatments work best for different types of people, and to create medicines that will treat or prevent common conditions, such as diabetes. Next slide. So what is the All of Us research program about in terms of participants? What will you be asked to do? Um, there have been changes in the program due to the current administration and changes in federal funding to support biomedical research. So some things have been changed, some things are no longer available, but what is currently still available, they have a website and you can go to the website. It's Join All of Us. And then when you go in there, you will see information about what All of Us research program is about. And then if you're interested, you can click on it to say you want to join. And that doesn't mean that you already joined. There's still a lot of processes that you have to go through, such as informed consent, where they tell you what it's about. They explain things to you, and then you have to give consent that you have to sign the document and say that you understand it and that you want to participate. And once you are enrolled that way, when you create your account, then right now there are online surveys that you can take, which are questions that pertain to the basics of information about you, information about lifestyle, personal and family health history, behavioral health and personality, social determinants of health. There used to be the ability to give blood samples, but now that part of it, in terms of having a journey bus that goes around the United States, certain places where people can go to the journey bus, which is like a mobile lab, and then they can measure you, they can take blood pressure, and they can get a blood sample and a urine sample. At this current time, the journey bus is not available. So when you create an account, when you go online, you will see what's the latest there in terms of what's available and what samples they may ask of you in addition to doing the online surveys. And whether or not you can share your electronic health records, I'm not exact, because that is also in flux. But they do have a number that you can call, which is the 844-842-2855, and they even have a chat. So you'll have to look at the website and then see what's available currently. Next slide. And in terms of showing you what information is available on the website. They have on the website something called a research hub, and I have the link there. And that's where they have surveys there. They have the aggregate information collected from, people who have participated already. So there's information about what biosamples have been contributed by people, what electronic health records have been contributed by people, and they also try to capture data from wearable devices such as like a Fitbit, how physically active are you, and who are the partners conducting research. None of the data pertains to you personally as an individual. No one will be identified. It's just a summary of what's happened to date. Next slide, please. Also in the research hub, for example, here's a data snapshot that I took to make these slides. And so probably I did it last week. So to date, out of 1 million participants that they're shooting for, they have 862,000 participants. So that's why it's still open for people who want to join. Of course, of the 862,000 people who enroll, not everybody contributed a biosample. So only 607,000 people have contributed a biosample. And then only 470,000 people have contributed electronic health records. So all this to say is that lots of people have joined, and then it's up to the person to decide how much information of themselves they want to share. And that's why the numbers are, of the electronic health records and the biosamples received do not equal 862,000. Next slide, please. Next slide. 雨欣, it's not,
挡住我，等一下，
okay. Is this the next slide?
不动了，等一下，好，OK。
动了. Okay. So that was the research hub. There's also something called the data browser. And for interest, I go into there and look at it. But the reason I'm showing this to you is that there's aggregate level data, meaning it's summary data of total numbers of people. It's not individual data. There are no personal identifiers. But there are these surveys that I mentioned that you can take. The basics, overall health, lifestyle, et cetera, and it tells you how many questions of those surveys are available in terms of the information you can see. And what you can do is click on each one, and after you join and after you fill out the questions, you can then go here to look at, how did other people answer the question? So it's an aggregate, it's a summary. And then you can say, well, how did I answer the question? And then you can find out just for your own information, whether or not you are behaving like everyone else or where the differences are. So it's just interesting to look at stuff like that. Next slide. So that's really all of the slides. There's not very much I can say because of the recent changes, and the program has to modify itself to be compliant with these current changes, right? Because of the administration change. But I want to show you the last two slides is how we have partnered with this program to encourage people in our Asian community to enroll. And we have been quite successful. We have helped to enroll over 100 people, more than 100 people in our Asian community. So last year in August, when the All of Us bus, you can see the bus in the middle there, it came to our clinic and was parked at our clinic for 4 days. And during that time, we outreached our community and encouraged our patients who came to see us to participate, and many of them did. And then they could go on the bus and be measured and donate samples if they want to. There's also the booth where information is being given out. And the team, you'll see the picture in the top middle. That's the All of Us team. They were on site and they would help the participants who are interested to register on the iPad. So that was last year in 2024. And then this year, next slide. This year they came again, but without the mobile bus. And so in April, we hosted them for another 4 days, and they were right in our new health center in the lobby in the reception area, and they set up their table there. And again, we encourage patients to go see them. We put out, some information so that any walk-in people who are interested, they can talk to the team, and then the All of Us engagement team would help them if they wanted to join the study. So they were quite successful this year as well. They engaged quite a few people and they really enjoyed working with us. So this is really the end of the slides, and I'm gonna, let me go through the next slide. So All of Us is about individualized precision medicine. At the moment, healthcare is often one size fits all, but of course, we are implementing precision medicine day by day. And in fact, in cancer therapy, we have a term called targeted therapy that's very targeted to the genetics of the individual and targeted to the type of cancer, too. But the reason I'm encouraging all of you to look at this and go into the website is that if we all contribute, imagine a future where your healthcare is tailored to you. And we want to make that future possible as soon as possible. And how do we do that? By participating and giving our data, contributing our data to go into the database, right? So the future of health research is now. We all have to do this now. So you'll see if you go into the website, they have the blue banner that says join now. You can click on there and you'll have more information open up for you. Next slide. And this is the end. So the future of health begins with you. The All of Us research program needs all of us, and our presence in medical research is essential to the future of our health, besides contributing to the general knowledge for everybody, right? But we are essentially doing ourselves a big favor by contributing our data that is pertinent and relevant to us. So thank you for listening, and I'll open it up for questions.